We're just going to give it a couple more seconds here to let some people in, and then we'll get started. So those of you that have joined us so far, we're just going to give it a couple more seconds, and then we'll get started. All right, everyone, now that it's 7 o'clock, I just want to welcome you all back. As you know, I'm Melissa Wilson, host of From the Clinic to the Living Room. Today, we're going to be discussing what I feel like is a very important topic involving melanoma and skin of color. As everyone knows, melanoma has made many advances over the years, and there's been increased advocacy. But there are still many people that think only Caucasian skin and the Caucasian population can get melanoma. So while people of color are less likely to develop melanoma, they are much more likely to present and die due to their delays in detection and delays in presentation. And so given that they present at later stages a lot of the time, it makes treatment a lot more difficult. So I wanted to make sure that we highlighted melanoma in this special population. And so my guest this evening is Dr. Andrew Alexis. He's the Vice Chair for Diversity and Inclusion for the Department of Dermatology. He also is Professor of Clinical Dermatology at Weill Cornell Medical College in New York City. He's the former chair of the Department of Dermatology at Mount Sinai Morningside and Mount Sinai West. He also is director of the first of its kind Skin of Color Center for the past 15 years, which has helped to advance not only patient care, but also research and education in this special population, which I think is absolutely amazing. So Dr. Alexis, welcome, and thank you for joining us tonight for this lovely webinar.
Thank you, Melissa. It's a pleasure to be here. Thanks for having me.
It's amazing to have you. So I guess I just wanted to start off with, a general overview of, how does melanoma affect people of color? Because it's not as typical as we see in Caucasian skin.
Yeah, consistent with what you said in your introduction, Melissa, while melanomas may occur less frequently in individuals with skin of color or darkly pigmented skin compared to individuals with lightly pigmented skin, the rates are by no means zero in patients with skin of color. So melanoma can affect anyone of any background, of any skin type, any racial, ethnic background. One example I like to use to really emphasize that is that the late, fortunately, from a melanoma that was on his great toe, on the toenail area where it started, and it was thought to be a soccer injury, just a bluish black discoloration on the toenail. He attributed it to his soccer. Delays in diagnosis. Finally, diagnosis is made that it's melanoma. And there were delays in treatment for a variety of reasons, but ultimately the melanoma spread to other organs, including his lungs and other organs. So that story of a very famous person really emphasizes that a lot of the key themes that we still face today, even though that was decades ago, a lot of the same themes are relevant today. That there's low awareness of melanoma among people of color, that the diagnosis is often made at a later stage, and therefore the prognosis is often worse. So unfortunately, we're still grappling with many of the same themes many decades later.
Yeah, which is really, it's so hard to overcome those kinds of things. And you think like with as mainstream as, with social media and how much advocacy is now happening in the melanoma population, you still see these big giant gaps. Um, and you had mentioned, obviously with delays in diagnosis that outcomes are worse. Like, how do you see trying to move this forward to try to make these gaps, like how can we lessen the gap? Like how can we make it so that, we don't have these delays?
Yeah, one important step is getting the word out through programs like this, really emphasizing that melanoma is something that can affect anyone of any background, and early detection is key. And so, can we detect melanomas early? Well, it starts with self-examination. It's important to know your own skin,
Sure.
understand, have a good understanding of what your baseline is, what your normal moles and growths actually are. And so you're in a position to be able to detect new or changing lesions. And something that's very important to emphasize is that when melanomas are seen in patients of color, there are variations in terms of which anatomic areas we're more likely to see a melanoma in individuals with richly pigmented skin compared to lightly pigmented skin. In lightly pigmented skin individuals, it's the sun exposed areas that are most common.
Right.
However, in those with richly pigmented skin, it turns out that the foot or the lower extremity is the most common location. So even places that don't really get the sun, like the sole of the foot,
Sure.
or the nail beds, or the mucous membranes, as in the lips or the genital area or the eyes, those are all susceptible to melanoma. But the foot is a very common location among, especially individuals of African descent.
Okay. So
So,
go
with
ahead.
that said, when looking at your skin for new or changing moles, one thing I'd really like to emphasize, and I'll try to emphasize with my patients too in the office, is don't forget to look at your feet too, and other places that don't necessarily get sun.
Yeah, and that's something that I think, is relevant for all, all groups. Like not it's not just,
Exactly.
richly pigmented individuals. Like we just had a case in my particular clinic where a gentleman similar to the story that you just shared, was a heavy soccer player. He, was in training and he was running a whole bunch and he thought that his shoes were ill-fitting and they caused this bruise on his foot that turned out to be an acromelanoma. So it's one of those things that like not only in folks with richly pigmented skin, like everyone should be looking at their feet and in between their toes and on the bottoms of their feet. And what are, when you look at, because we get this question a lot, like what kinds of things am I looking for in richly pigmented skin that may be different? Like I know obviously the location, but in terms of like what do the pigmentations look like for these folks? Like are they different from, because you see the graphics of like this is what melanoma looks like, and I would imagine that that may be similar but also a little bit different in deeper pigmented skin.
Yeah, so there are indeed similarities when it comes to what to look for melanoma. If you have skin of color or lightly pigmented skin, there's some similarities. Number one, if there's a new or changing uh, brown or black spot on the skin, that could be a warning sign for melanoma. So, um, there's the so-called ABCDs of melanoma that many people know. And so some of the potential warning signs would be asymmetry. We like pigmented lesions that have symmetry, as opposed to sort of irregular and asymmetric shapes. We like uniformity of color. That's usually a benign feature, but if there's variation of color within the lesion, that could be a warning sign of at least an atypical lesion or possibly melanoma. The size, being 6 millimeters or less, is a reassuring feature. So when it's greater than the size of an eraser on a number, if anyone knows what a number 2 pencil is anymore.
Not anymore.
But if a brown spot is larger than a certain size, that could be a warning sign as well. But specific to skin of color, here's where some things that are a little bit more specific. And this is where it gets very difficult, because on the nail beds, one can see brown pigmented streaks that are linear, which we call melanonychia. Could be completely normal, but in some cases it's not normal and it's melanoma. So how do you know? What's the difference? Well, in the normal variant of brown streaks in the nails, which can be seen in deeply pigmented skin tones, they generally involve multiple nails. On the hands and feet, they tend to be pretty sharp. They have a good sharp border. The color is is very uniform, and the pigment should not extend to the nail fold, to the proximal nail fold, which is at the base of the nail, or to the distal nail fold, which is at the tip of the digit. So the color should be confined to the nail. It should not be changing in size or hue. Should remain stable over time. So that's one way that we differentiate those pigmented bands on the nails, the normal ones versus melanoma. Similarly, on the soles of the feet or the palms of the hand, it may be completely normal to have brown spots in deeply pigmented skin tones, to have normal brown spots on the feet. But where it becomes abnormal is, again, if there's asymmetry, a change in size, and any irregularity in terms of, let's say, evolution from flat to raised. Well, that would be very significant.
Sure.
Reevaluation. So it's really a collection of different things that we look for, but something that everyone can do, evaluate, and be able to detect new or changing spots.
One of the other areas, and when I was preparing questions for this webinar, I was like, what about vitiligo? So, in Caucasian skin, with vitiligo, those places obviously have no pigment to be protected. And in vitiligo, in richly pigmented skin, is there a greater risk for developing melanoma in those spots? Like, not on the typical, hands and feet and palms and soles and, lips and mucous membranes? Does that make it, like, if you have, vitiligo on your arm, does it make you more likely to develop a melanoma in richly pigmented skin there?
So it's a great question, Melissa, and I get that question a lot. But it turns out it's very interesting that in vitiligo patients, even though in the white patches of vitiligo there's a lack of pigment, it turns out that melanoma risk is not higher in vitiligo patients. There are a number of studies that have shown that, and the thinking is that because vitiligo is being an immune-mediated condition, an autoimmune condition, where there's actually upregulation of the immune response, in this case targeted towards the melanocyte, the pigment-forming cell, because of that heightened immune surveillance or immune upregulation, that has a bit of a protective effect against skin cancers.
Yeah, so
So,
even development of acromelanomas, it would be protective as well, right?
so as far as within
Right.
vitiligo lesions, there is not an increased
Okay.
risk
But
of,
it doesn't protect you against development of melanoma at a distal site somewhere else.
no, no,
Okay.
no.
That's helpful information.
And that's to be differentiated from another condition that presents with lack of pigment, and that would be albinism.
Mm-hmm.
So albinism, where there's a genetic defect in the synthesis of melanin, so there's also a lack of pigment. That population, by contrast, is at much higher risk for skin cancers, including melanoma, but squamous cell carcinoma, basal
Well,
cell carcinoma, and melanoma. Yeah.
all skin cancers,
Yeah.
right?
Mhm.
Um, so I guess, we did have one question, but I think you kind of already answered that, and this person may have missed it, but they asked, is there a specific type of melanoma that's most often seen in people of color more often than in Caucasian skin? And you did answer that, but if you could repeat yourself just so that this person who joined late can hear.
Absolutely. So the most common type of melanoma that we see in individuals with skin of color, especially those who are Black or African American, would be melanomas on the palms of the soul, the palms, the soles, or the nail beds. And we call those acrolentiginous melanomas. So that is the answer to that question. The most common type of melanoma in patients of color is acrolentiginous melanoma. And these occur on the palms or soles, or nail unit.
Perfect. So I guess, one big thing for me, and because these aren't areas that are so heavily sun exposed and thought to be directly related to sun exposure, like what type of precautions or recommendations should we make to our patients of color, as our family members and our caregivers and our friends, and really to get this advocacy work out there? Like what precautions should we share?
Mm-hmm. I'll take a step back and say that, when we say patients of color or people of color or skin of color, we have to recognize how diverse that population
Very diverse,
is.
correct?
And
Yeah.
so we're talking about someone with sort of light brown pigmentation, maybe self-identifies as Hispanic or Latino. That individual may have a different sort of set of risk factors and typical presentation of skin cancer than someone who, let's say, has type 6 skin with very deep pigment and may self-identify as Black or African American. So even though we both types of patients would fall under the umbrella of skin of color or people of color, they may have variable variations in the risk of melanoma and where they occur. So I just want to be clear on that.
For
So
sure.
even though we're emphasizing the palms and soles and nail beds, in the entire spectrum of patients with skin of color, there's still melanomas that occur in sun-exposed areas too.
Sure.
So
So,
to your question, yeah, go ahead.
yeah, no, so to get to my question, I think, one of the myths that sort of have been populated within our culture is that just like you said, someone that may identify as Hispanic with lighter brown skin, that they don't need to wear sunscreen because they're protected from the sun, because they might tan a little more easy than someone with very pale skin. I always tell all of our patients, because we, even, my father is a very deeply pigmented Italian man who, I clearly do not take after his pigmentation, and he goes out in the sun and doesn't think he needs to wear sunscreen. So, like, I think, do we need to still recommend, sun precaution, sun avoidance, sun protection to these populations as well? What other types of things, besides, besides sunscreen would you recommend? Or is that, just it?
Mhm. So I still, to answer your question, I would recommend sun protection or photo protection for all.
Right.
Um, we're talking about melanoma today, but I will add that there are other benefits to protecting your skin from the sun,
Absolutely.
including accelerated skin aging, which is an
Yes.
effect of UV, pigmentary disorders like hyperpigmentation, which is particularly relevant and prevalent, highly prevalent among patients with skin of color. So there are a number of reasons even beyond skin cancer, to protect the skin from the sun. That being said, what does that mean, protect the skin from the sun? So I would say for areas that are exposed, daily wear of a broad spectrum sunscreen that's SPF 30 or greater. The easiest thing to do is have a moisturizer that has SPF 30 in it, and use that on your face and other exposed areas on a daily basis. When you're doing things that are more involved, more outside, prolonged outdoor exposure, then of course you've got to do extra applying sunscreen beyond just your face. Got to cover all the areas that are exposed and reapply every 2 hours. And then other steps beyond just application of sunscreen would be being careful and selective about when you do your outdoor activities. There's a difference between doing your outdoor activities between 10 in the morning, before 10 in the morning and after 4 p.m. and missing those peak UV rays in the middle of the day. That's very important too. So if you when planning outdoor activities, trying to do them early in the day or later in the day, rather than smack in the middle of the day where the UV rays are most intense. Wearing a hat with a broad brim hat, also a very important aspect to sun protection, and simply seeking the shade. You can go outside and enjoy all the things that there are to enjoy outside, but taking these extra steps go a long way to protecting your skin from the sun.
Absolutely. So, one of the other questions that I had for you, especially given your work in, the Skin of Color Center, is like, what do you see as the biggest barriers to folks presenting? Is it just that, like, awareness of advocacy? Like, what do you think is the reason that there's such a gap?
Yeah, I think if we ask ourselves, well, why do we see this tendency towards delayed diagnosis and worse prognosis? I think it's multifactorial, but it includes lower awareness by the general public that yes, you can get skin cancer, including melanoma, as a person of color. B, when it does occur, it might occur in places that are less sun exposed. So these are areas that tend to be surveyed less frequently. People
Sure.
have lower tendency to examine such areas, and that can contribute to delays in diagnosis. And then on the whole, there can be social determinants of health, socioeconomic factors, barriers to getting to the right specialist to have a skin exam. And there are some disparities there by race and ethnicity.
Which, I think, we see oftentimes too in areas that are like more sparsely populated, that folks just don't know, they're not familiar with, like, where do I go to the dermatologist? Like, we had a call a couple of months ago on our, hotline for AIM that, they just were like, I have this pigmentation, I don't even know where to go. And I'm like, start with your PCP. There are ways that we can get you evaluated. Like, somebody, even if a healthcare provider sees something and they don't know what to do with it, perhaps they can get you to someone that does. And so I
Right.
think, for me, part of wanting to do this webinar with AIM is just, as you said, to just get the word out that, melanoma can happen in any skin, in any race, in any population of patients. And so just being really aware that this can happen, to help hopefully lower, this misinformation and lack of awareness, is really our goal.
Yeah, thank you.
Is there anything that we can do to kind of help outside of doing things like this?
I think this is really key, getting the word out among our own healthcare provider community. I think continuing to educate ourselves about what are some of the key things to look for and prioritize when screening for melanoma. I think that when it comes to the treatment of melanoma, once the diagnosis is made, there are reported racial ethnic disparities.
Mm-hmm.
And so one of this disparities relates to clinical research trials for some of
Yeah.
these new advanced, potentially life-saving therapies for melanoma. We don't see very high enrollment of patients of color, so there's a lack of diversity in clinical trials. That's another area that could be worked on. And back to public awareness again, informing the community that there are such things as clinical trials, and that may be beneficial to those who get this diagnosis.
Well, hopefully we can do better, because I think that, we want to impact all of the patients and help them, to get care and get access to care and get access to clinical trials. So, if there's ever anything that we can help participate in or make better from AIM or from, our population, we're out at the University of Pittsburgh. We're always happy to help you.
Thank you.
I happily, thank you so much for joining us here tonight. I think that this is just the start of what we should be doing and can be doing to help raise awareness. And, if you have questions, I know we didn't get a lot of questions on this webinar tonight, but, if there are questions that you have, attendees, or if you're watching this after the fact in a recorded setting, please feel free to reach out to us. Now I have Dr. Alexis's contact information. I can get you in touch with him if there are specific things that he can help with. I'm sure, that we can get you in touch with them. I appreciate you coming, and I guess
Thank you, Melissa.
we'll call this a night. But I would love to do some more things in the future to raise awareness if you'd be up for it. So
Absolutely. Well, thank you again. It's a
you're
pleasure.
very welcome. We'll have a good night. All right.
Yeah, you too.